Let's talk about vaginal discharge. This is a problem a lot of women encounter. Vaginal discharge, different colors, and they are trying to know what is normal and what is not normal. Is it infection? Is it STI? What is the problem? Is it gonorrhea? Is it chlamydia? Is it yeast infection? A lot of women are concerned about their vaginal discharge and what the color means. So that is what we're going to be discussing in this video today. I'm going to be explaining the different vaginal discharge colors and what it means. So hello guys, what's up and welcome back. This is Everything Health with Nurse Dara. In this channel we get to discuss different topics related to health. If you're seeing this face for the first time, I am Nurse Chidera Cynthia. I'm a registered nurse, registered midwife, registered public health nurse, and a Bachelor of Nursing Science degree holder, currently practicing here in Nigeria. If you're interested in this topic, keep watching. I'm going to start this video by explaining the things to look out for, signs to look out for with regards to your vaginal discharge, signs that something might actually be wrong. So whenever you notice any of these signs that I'm about to list out, then it would be wise for you to see your doctor and get that checked out. The first sign is offensive, foul, or fishy smell. So whenever you notice this offensive smell, it's a sign that something might actually be wrong. The vagina normally have an acidic smell, a mild acidic smell, but when you notice a fishy smell, an offensive smell, then that is actually a sign that something might be wrong and it would be wise for you to get it treated. The second sign for you to look out for is high volume or copious discharge. Women normally have discharge, especially during different stages of their menstrual cycle, but we are talking about when this discharge is actually in high volume or is copious, that it can even soak through your underwears. It's actually a sign to look out for. This leads us to the third point, which is actually color. Normal vaginal discharge should be off-white or clear depending on where you are during your menstrual cycle, but when you're seeing colors like green, yellow, cream, when I say cream I mean all those cream with lumps like yogurt, those are actually signs that something might be wrong. Another point is itching. That is not normal. Then you have burning sensation, especially after urination or during sexual intercourse. Then the last one is reddish and swollen vulva. Now let's get into the main topic, the different vaginal discharge colors and what they mean. The first on my list is going to be clear discharge. This is a very normal vaginal discharge and that is why I'm going to start with it. This discharge is actually normal. It can come when you're sexually aroused. You know, when people say things like she's wet, yes, that is the clear discharge. It is very normal. It can also come during breastfeeding and depending on where you are during your menstrual cycle, like during your ovulation day or towards the ovulation day, this clear discharge can actually become stretchy. It looks like egg white. It is transparent in color. Then after ovulation it can go back to being slightly thick. This is a normal discharge. It have no foul smell, it have no odor, it is just there with a slightly acidic smell. That is a very normal vaginal discharge. Another type of vaginal discharge is the yellow or green discharge. This is an STI, a sexually transmitted infection that can be caused by Trichomonas vaginalis. It is a sexually transmitted infection that can be transmitted from one partner to another. So when you sleep with a person who is infected with this, it can be transmitted to you. This is why we always speak against sleeping around or having an unfaithful partner, because they can actually get it from someone who is infected and then give it to you. That is what sexually transmitted infection is all about. It keeps moving from one person to another. So it is always good to practice safe sex and having just one faithful partner. It can reduce your risk of actually getting this infection. Sometimes when we talk about safe sex, some people think we are talking about taking pills, all those family planning medications, injections, IUDs and the rest of them. That is not what we mean by safe sex, okay? When we talk about safe sex, we talk about using protection, using condoms, because you can actually take pills, but these pills are not going to protect you from sexually transmitted infection. It can only prevent pregnancy, but it can't prevent STIs. Some of the symptoms of this condition is that the woman experiences offensive, foul odor, fishy smell, burning sensation, especially after urination or after intercourse. The woman experiences soreness in the vagina. You need to get treated together with your partner. If possible, the previous partners need to get treated as well. So everybody needs to get treated. That type of STI that can cause this yellow or green discharge is gonorrhea. It is also a sexually transmitted infection. Sometimes it can be asymptomatic, that is no symptoms at all. For the women who have it might experience burning sensation and yellow vaginal discharge. Another discharge we're going to be talking about is cream or white discharge. When I say cream discharge, I mean clumpy cream. You know, clumpy cream like yogurt, those yogurt that have clumps inside of them. This is what it looks like, and it can be caused by thrush. This is a yeast infection. I'm going to quickly explain what this yeast infection is all about. Yeast is actually a bacteria found in the vagina. It is there in the vagina. It is in every woman's vagina. Women have normal healthy bacteria, the unhealthy bacteria, but there is a balance between the two of them. None of them is supposed to be more than the other one. So with yeast infection, this is usually when the woman takes too much of antibiotics. Maybe the woman have a problem that she needs antibiotics for. Let's take for instance, the woman have a tooth infection and she needed to take antibiotics, and then she kept taking these antibiotics for a long period of time. Antibiotics is just going to go there in the body and start killing every bacteria it sees, including the bacteria in the vagina. Antibiotics doesn't care about if the bacteria is healthy, if it's not healthy, if it's meant to be there, if it's not meant to be there. Once it sees bacteria, it kills bacteria. So it ends up killing all these bacteria, the normal bacteria, the ones in the vagina as well, the ones that are there competing against these other bacteria that are not healthy. It just kills everything. So when it eventually kills these other bacteria in the vagina, the yeast have no other bacteria competing against them. Then it decides it is time to come out in full force. It starts overgrowing, it starts growing rapidly, leading to yeast infection and causing this white or creamy lumpy vaginal discharge. Sometimes this can be asymptomatic. That means the woman won't experience any symptoms at all. The woman won't even know that she have yeast infection. But some women experience symptoms, and the symptoms may include burning sensation, especially after urination or during intercourse, itching, there is offensive smell, foul odor, the vulva is red and swollen. But sometimes a woman can have a normal cream discharge without any of these symptoms. So when you experience maybe this cream discharge is not copious, it have no odor, it doesn't automatically mean that you have yeast infection. It can still be a normal vaginal discharge. Another type of this vaginal discharge color is gray discharge. This is also called bacterial vaginosis. It is not really a sexually transmitted infection. It's not really an STI, but it is usually found among women who are sexually active. This usually happens when there is a change in the pH of the vagina. The pH becomes more alkaline, and this can be due to washing inside the vagina. So women are fond of doing this, and it is not advisable at all. The vagina is a self-cleansing organ. It cleans itself by itself. When I say vagina, I mean the inside, okay? The outer part that you can actually see with your two bare eyes is called the vulva, but the vagina is actually inside. So some women end up trying to wash inside. Some are douching, putting things inside there, trying to clean it, using scented soap, scented perfumes, spraying in there, but then they end up messing up the pH level of the vagina, causing the vagina to become more alkaline, and this can lead to bacterial vaginosis. So it is not advisable to douche. It is not advisable to attempt washing inside the vagina. Just washing the vulva area with clean water, no scented soap, no antiseptic, or even using antiseptic wipes. It is not advisable. That area is very delicate, and anything can throw off the pH level of the vagina. So when the pH level of the vagina becomes more alkaline, it can increase the growth of this bacterial vaginosis, causing gray discharge. So it is usually not associated to itching or burning sensation, although some women experience that, but most women experience foul smell, and most women notice this foul smell after having their bath or after sexual intercourse. It can be treated with antibiotics. The last vaginal discharge color we're going to be talking about is a red or pink color. So when you have this discharge, probably nothing is wrong. It can be an early sign that your period is about coming, or the dark red or brownish red color you see towards the end of your period is actually that color because towards the end of your period, you notice the flow begins to slow down. So this can mean that blood is hanging around for a longer period of time in your vagina, and the flow of the blood has become slow and the blood have become oxidized. So that is nothing to worry about. Then we also have the pinkish color, the pinkish red color. Sometimes you can notice this light discharge or spotting, at the same time you're supposed to get your next period, and it might actually not be your period. It might be what we call implantation bleeding, which is an early sign of pregnancy. It happens when the fertilized egg is trying to attach itself into the uterus, where it's going to stay and develop into a baby. Then there's also light bleeding that can occur when a woman is already pregnant, especially during the first trimester, which can be miscarriage. That is why I always advise women, pregnant women, that once you notice blood coming out from you at any point in time throughout your pregnancy, you're supposed to go to the hospital, see a doctor, and get that checked out. So with this, we've come to the end of this video. I hope you were able to get one or two things out of this. If you enjoyed watching, please do well to give this video a huge thumbs up, subscribe to my channel, leave a comment in the comment section if you have any question, and I'll be there to respond. Turn on your notification bell because I have more informative and educative videos coming your way on this channel. This is it for now. Stay tuned and see you in my next one. Bye.